Hey guys, welcome back. Today we will discuss about other psychiatric topic, that is dementia. Dementia is an organic brain syndrome. So what is dementia? Dementia is an organic brain syndrome with ongoing decline of brain functioning such as memory loss, speaking capacity loss, judgment capacity problem, and other abilities to perform daily activities due to damage of nerve cells. So in dementia, you will see impairment in the cognitive functioning along with severe memory loss. There are many different types of dementia and many causes for dementia that we will see in the future discussion. Dementia is characterized by loss of memory, thinking difficulty, language difficulty, understanding problems, judgment difficulties, difficulties in doing daily activities, mood changes, hallucination, and complete dependency on others to perform all activities including personal care. So, it is characterized by loss of memory, thinking difficulty, language problem, understanding problem, judgment problem, difficulty in doing activities, mood changes, hallucination, and complete dependency on others to perform the activities. Now we will see the types of dementia. There are different types of dementia we can see. We have 5 types of dementia. First thing is Alzheimer's. So dementia is an umbrella. Under that umbrella, we can see different type of memory loss. First thing is Alzheimer's. Alzheimer's is the most common type of dementia. Around 60 to 80% of dementia is Alzheimer's. Next is vascular dementia. Vascular dementia is characterized by difficulties in memory due to problems in the blood vessel. So damage will happen in the blood vessel which is present in the brain, which provide oxygen and blood to brain. Next is Lewy body dementia. That is an abnormal balloon-like protein. Abnormal protein presence in the brain, and that is responsible for memory loss, means that is Lewy body dementia. Next is frontotemporal damage, and that leads to loss of memory and cognitive impairment, means that is frontotemporal dementia and other type of dementia. So dementia is an umbrella term for loss of memory and other thinking abilities severe enough to interfere with daily day-to-day life. The types of dementia are Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. So these are all the types of dementia. Other symptoms of this dementia are short-term memory, loss, forgetting parts of valid, which is very important in your daily activities, right? Then forgetting paying bills, forgetting planning and preparing meals, forgetting appointments, forgetting to travel or traveling out of the neighborhood, etc. Well, coming to the psychological changes occurs due to dementia are personality change, depression, anxiety, paranoia, agitation, and hallucination. They will smell something which you can't smell. They will taste something which you can't taste. So hallucinations, agitation, difficulties, loneliness, paranoia, something unusual and abnormal things, anxiety, anticipation of fear, depression, personality change. So these are all the psychological changes you can see in dementia apart from others cognitive impairment. Next thing is causes. The main cause is damage to the brain nerve system. So nerves are damaged is the reason. Apart from that, injury, stroke, alcohol and substance abuse, excessive use of any drug, infections like encephalitis, and thyroid problems and vitamin deficiencies. So these are all the other factors, but the major reason is damage to the brain cells. And apart from that, you can see the risk factors which is not treatable. They are age, Down syndrome, and family history. So age is a factor which you cannot change, family history that you cannot change, and the Down syndrome that you cannot change. So these are all the causes which normally we are seeing for this dementia. Next thing is diagnosis. Medical history, physical examination, laboratory test, mental status examination, neurological examinations. These are all the major diagnostic procedures which we are using to diagnose this condition. Well, coming to the management, of course, treatment is there, but there are some limitations for treatment, and always the treatment of dementia is depend upon its cause and type, depend upon the type. If it is Alzheimer's, different treatment. If it is Lewy body type, different type. If it is due to vascular problem, different type. So the treatment is always depend upon the cause and depend upon the type, and in fact there is no cure for this condition. But there is one treatment is there, that is known as aducanumab. That means first therapy to demonstrate that removing amyloid as a protein from the brain, one of the major reasons to decline memory in Alzheimer's disease. So that is a treatment which is prevailing. That is a therapy which is using to remove the amyloid protein that is responsible for this memory loss. So but there is no proper treatment for this condition. Treatment is depend upon the type and cause of dementia, but there are a lot of preventive techniques will be there. Or the risk factors, if you prevent these risk factors, means definitely you can do some changes in the condition of dementia, like diet and exercise. Do proper exercise, eat properly, avoid alcohol and smoking, and avoid or stay away from depression. Diabetes is a problem which can create problems in your whole body. So do healthy things to avoid diabetes, or stop or prevent diabetes, or control diabetes, and avoid smoking. Excessive air pollution, sometimes that will affect your nerve cell functioning, so get away from that. Then cardiovascular problems, if you can avoid, means you can manage this condition, dementia. But complete cure from this condition is impossible. There is no cure for this condition, but you can prevent or you can reduce the risk of the risk factors. So this is about dementia. So dementia means loss of memory, loss of judgment capacity, loss of thinking capacity, loss of speaking capacity, or altogether impairment in the cognitive functioning due to damage of your brain cells. So it is an organic brain syndrome. And details about Alzheimer's are there in other video. I will add the link of that video in the description box. Okay. Hope you understand, guys. Thank you.